Hi, welcome to AAUW Connections. Tonight we're going to be talking about a very serious and ever timely, unfortunately, subject, and that is strokes. And specifically, we will be talking from, our guests will be from the Peninsula Stroke Association, which is not a part of the American Stroke Association, but is a freestanding organization here in our area. And our guests are Nancy Houston Miller, who is a nurse, who is a board member of the Peninsula Stroke Association, and who is the associate director of the Stanford Cardiac Rehab program. Also with us is Vangie Uribe, who is a stroke survivor, and we'll be hearing a lot more about that, and her husband, Matt Sorgenfrey, who is also the chair of the board of the Peninsula Stroke Association. So why don't we start, Nancy, just talking about the Peninsula Stroke Association. When was it founded? What are its objectives? That sort of thing.
Certainly. So the Peninsula Stroke Association actually is a nonprofit organization that serves both Santa Clara County and San Mateo County, that was founded in 1998 by 6 community activists, and including a couple of physicians who were very, very concerned. They themselves had had strokes and were lacking resources and information around what they needed to really survive and survive well. And so they founded the Peninsula Stroke Association with a very defined mission. And that mission was really to reduce the incidence of stroke by providing education, and to help the aftermath of stroke and stroke survivors by providing programming to stroke survivors, their families, and the caregivers.
Okay. And so those are the kind of the two, the educational aspect and the assistance to stroke survivors and caregivers.
Yes.
And those were obviously what their motives were. And I know that most of us, probably everyone watching, I hope, knows that there are certain warning strokes, warning signs of a stroke. We don't always remember what they are. I believe there are 6 of them.
There are 6 of them.
What are they?
There are 6 of them. And the Peninsula Stroke Association has helped individuals to try and remember the stroke signs by providing magnets and these little cards, and these are in bilingual, many languages, Vietnamese, Chinese, Spanish, to help people to remember the signs of stroke. And the signs of stroke are everything from sudden difficulty talking and remembering words, to sudden loss of feeling and strained sensations on one side of the body, to sudden weakness in the face, the arm, or the leg of one side normally, to sudden, severe, unexpected headache, which often we see with hemorrhagic strokes. And the last
said earlier,
2,
it's sort of like the worst headache you've ever had in your life.
It is actually the worst headache that you've ever experienced, and for an unexplained reason. And then the last 2 include sudden decreased or blurred vision, and finally weakness or unexplained dizziness that causes loss of balance.
Now, you mentioned earlier SOS.
So we use a couple of acronyms to help people to remember, is this person having a stroke? One of those is SOS. And so you can look at a person and ask them to talk, and if there's no speech, that's one of the signs. A second thing is to ask them to hold their arms up, and normally, and to make an O, and normally if they're having a stroke, an arm will fall. And the third is to ask them to smile, and if they can't smile. And normally they'll have 2 out of the 3 of those signs. And the important thing is that people call 911 immediately, because individuals may be having a stroke.
Now, is it necessary to have 2 out of the 6, or if you had one of them, is that enough?
If you had one of those, it's enough to seek medical attention and to at least make a call to determine, is somebody having a stroke?
And I guess the point is to call 911, not to say, let's hop in the car and I'll drive you to the hospital.
That's exactly right. The important thing is that stroke is a medical emergency. When people are having a stroke, time is of essence and very, very important, because brain cells are destroyed and continuing to be destroyed once the stroke occurs.
And that brings us to Vangie's story. Vangie and Matt, who became the caregiver in chief.
Yes.
what signs did you have?
Well, I had had headaches for a long time.
A long time? You mean-
Long time.
Oh.
Years. So I had really bad headaches.
Don't try this at home.
Yeah, but
Years of
I
headaches.
had had several MRIs, and those headaches were diagnosed as migraines. So when I was having one, I knew immediately it was a stroke.
How did you know then that it was a stroke? If you had been having these migraines all along and now you had this, was it just so terrible?
Yeah. I had done a lot of research before on headaches, and that led me to the strokes.
And Matt, you were there?
I was there, and the difference, besides I couldn't understand her at first, but her left side started slipping away.
Right.
And I volunteer with the Palo Alto Fire Department, so we've had some of the training. My impulse was to call, which I called right away on it. For her, she couldn't hold her hands out as she held them there crossing. So we knew it was much different, that this was going incredibly fast. So we really pushed along the procedures.
So you called 911?
Well, as soon as I couldn't understand her, first off, if a person's behaving normal and all of a sudden for some reason they're not, I'm already, and everybody should be very suspicious. Look, you see anything else. The other reason for calling 911 is that there's now stroke procedures. Ours was 6 years ago. There weren't stroke procedures, but now the ambulance knows to call. The hospital does different procedures. There's no waiting.
Before you arrive, the ambulance calls ahead.
Absolutely, so that the rooms are ready, the specialists are ready. All of this is in place. And that's come from this education, particularly as everybody hears this. It's real important to think, what are the things I can add to help with these situations?
Now, we often hear that there's and I believe it's even on the cards, that there's about a 3-hour window when you must get care, and that's so important. But in Vangie's case, I believe, there was no 3-hour window because of the type of stroke she was having.
Correct. She has a malformation. It's in the venous system, so it's the thing now that before people just didn't survive this because it was so rapid that care wouldn't get to people at all. So it tends to be hereditary that we think this happens, but what we're speaking of is a bleeding stroke.
Is that what you called a hemorrhagic
That's
stroke?
what I call a hemorrhagic stroke. Most strokes are known as ischemic strokes, in which there's often a blood clot that causes the lack of blood flow and oxygen to reach the brain. What happens with a hemorrhagic stroke is that often there is an artery in the brain that bursts and blood spills into the brain and to the tissues that's surrounding and causes a lot of swelling. And that's why we, as Vangie said, there's this severe headache.
Because of the swelling.
Because of the swelling in the brain and with blood spilling out to the tissues. And the important thing is that people get to medical attention right away because, as Matt mentioned, we have life-saving medicines and procedures and interventions that can be done very, very quickly to reduce the size of the stroke and to get rid of the clot that's there and to cause much less damage than previously occurred many years ago.
So, but even 6 years ago, there weren't quite the techniques that there are now, you say. So,
Absolutely not.
So 911 came right away. And was there anything they could do on the way, in addition to notifying the hospital that they were coming with a probable stroke victim, correct?
Correct.
The other thing that's happened, and the other wonderful thing that's happened, is that in both Santa Clara County and San Mateo County, almost every hospital in the county are now considered to be stroke centers. And you find that in few areas of the United States that are as well equipped as our hospitals are, that have stroke teams that actually have a neurologist on call 24 hours a day who is available to come immediately to the emergency room to take over. And
So whoever that neurologist will be there immediately, not
Exactly.
an hour from now.
Exactly. To perform a CT scan or an MRI to determine is this patient having an ischemic stroke or a hemorrhagic stroke.
So in Vangie's case, you got to the hospital.
Yeah. The difference in the saving thing for us at that time, there was an anesthesiologist that was an Iraq veteran. So the staff was not prepared for us, the trauma, because when she was she was in a very bad state when we got there, very close to unresponding. And so to have somebody in this real type of trauma, she was able to take over, and we were kind of insistent and got procedures going until we could locate a neurologist. As Nancy was saying, the procedures are much different today. So our story is different in that there was a lot of confusion at the site when we got in. And again, thanks for the vet that knew, and then we could communicate, having been at least exposed in trauma. I knew what should be happening.
So whereas Vangie was fortunate, because you knew what was happening, you were with her, she wasn't alone, you knew what was happening, you knew what some of the right questions and demands almost to make when you got there.
Right.
Nowadays, you're saying, Nancy, most of these hospitals, which are stroke centers, have had adequate training that even if you were with someone who wasn't an emergency response person,
they know exactly how to respond.
Know exactly how to, and so,
exactly how to respond.
So you had surgery, I believe this was, and a number of surgeries. You were in the ICU for
3 months.
Yeah, 3 months, 90 days we were there.
When you ultimately were discharged, after, I think when you ultimately went home, I think we said earlier, 5 or 6 months.
6 months.
Is that when the therapy started?
About 6 months after that.
Well, yes and no, and it's also
it's
also interesting with stroke too, because about 3 minutes into the stroke, she's out of it.
We have no concept of time.
Well, that's a blessing in your case.
But particularly for her right away, the physical therapy, OT, speech, everything starts when you're still even in ICU.
Right.
Because there's lots that still has to happen beyond just evaluation. And particularly, this is also the encouraging thing that we bring forward in the Peninsula Stroke. The research, and particularly the research in the field of rehab, has rocketed ahead. That even now, we have, so the Peninsula Stroke has a medical advisory board of 19 specialists in this area. They're very quick to say now, rehab is different. And we make no predictions now with rehab because it's changed. We were very fortunate.
It's changed from what it used to be?
Yes.
We were fortunate that our neurologist had the very latest training, and he could say, let no one tell you what you can do right now. There's no neurological damage. So even my doctor to this day still will say, well, I thought after 6 weeks, 6 months, throughout a time, that's what you get. That's not the case. So that's why now rehab begins when you're in the hospital. And it continues. Now, what Vangie's speaking of is the rehab she does now.
And that goes on even now. We were talking earlier about even though it's 6 years since the stroke, and you've obviously made enormous strides, you still have therapy.
Physical therapy, speech, and Pilates twice a week.
Pilates, that's amazing. Now, is there any difference in the pattern of strokes in men versus women, young people versus older people? Do they get them at different times of their lives? What are the statistics
Well, women,
about that?
like heart attacks, get the strokes a little bit older. They're a little bit older in age. And if you look at the science, it turns out that women tend to have the aftermath is not as good for women. They have more severe damage. If you look at the studies, they have a little bit more depression. Their quality of life may not be as good. But the important thing to recognize is that if you really look again at the science, is that about 80% of all strokes could be prevented. And so while it's the leading cause of disability, and it's the 4th leading cause of death, about the Neurological Institute believes, and the scientists that have been studying this for years believe that about 80% of strokes could be prevented.
And
So
you
that's-
work actively in that field. I mean,
I do. I do. So the risk factors for stroke are very similar for those individuals that have a heart attack, and that is not smoking, keeping your blood pressure under control, keeping your cholesterol, especially the LDL cholesterol, which is the bad cholesterol, low, treating atrial fibrillation, which is a different risk factor for stroke if you have it, making sure you're treated, treating diabetes. And I'm forgetting one additional thing, Matt.
Yeah, I can't help you,
Those
sorry.
those are the main. Those are the main risk
that any of
factors.
us can do
Right.
to help.
Exercise. Exercise
ex-
is another important thing.
Now, one of the important things, as you said, is the public outreach that the Peninsula Stroke Association does to educate the public on this type of, just the kinds of things you've been talking about. Now, I understand you have support groups?
We actually, the Peninsula Stroke Association, because the mission is very defined, I think, is able to do programming and education in a major way. And we reach about 60,000 individuals on an annual basis through
60,000 different individuals.
different individuals through our awareness raising by promoting such things as our magnets and our cards here. We may go to a train station early in the morning and pass 5,000 of these out to individuals.
Now, if
And
someone out there watching tonight says, I don't have one of these, I'd love to have one, how would they get it?
they can get this by calling the Peninsula Stroke Association or by emailing the association, and all of the materials that we have are free, so that we would be sending, any person that so chooses to avail themselves of these kinds of things. We'd be sending them free in the mail.
And your website and your phone number is running across the bottom of the screen now, so
Great.
that they
That's
can
great.
contact you in that way.
The second thing you asked me about is basically our programming for stroke survivors.
Yes.
We reach about 600 individuals on an annual basis who have survived a stroke, and their family members.
And that's just in Santa Clara and San Mateo County.
Yes.
Yes.
Well, the strokes are so widespread. How many? What was the incidence?
Before we were talking, in the U.S., statistically right now, 1 every 40 seconds, someone has a stroke. So just in the course of this show, 45 people in the U.S. will have had a stroke. So as Nancy says, leading source of disability. You also think, as my wife has a stroke, my life doesn't stop. But yet that stroke took out 2 of us out of our normal lives.
Oh, sure. Both your lives changed.
So
Yes.
think of that, and then everybody we're associated with. So it's a very rapid affecting situation you have here. So that's why the prevention and really the awareness is so key, because if you can intervene quickly, you have the chance of a better recovery.
And then and Nancy is saying that you reach 60,000 stroke survivors in our 2 counties each year.
We reach about 60,000 individuals through both awareness and through helping stroke survivors.
Oh, okay.
So
So
in
there aren't,
total,
you don't deal
we
with
have-
60,000 stroke survivors
No,
every
we
year.
on average about 600 stroke survivors are going
Still.
to 10 stroke groups that we run in the areas of
Support
Los
groups.
Gatos and Mountain View, Palo Alto, San Jose. And you can go online again at the Peninsula Stroke Association and find out when those stroke monthly support meetings are being held and the topics that are being discussed, those kinds of things.
Now, Vangie, you did go, or did you go to a support group?
I did not go to one. I
For
did go to
caregivers.
one.
For caregivers, where some of the activities Vangie goes are the larger group events that
Right.
have the stroke survivors at them, which is another thing that we offer.
do.
Along with our education for professionals, we mix it, that there's also stroke survivors and caregivers
Right.
at the same training. So we're socially there, and particularly Vangie has several friends that can see the same progress, and that's very huge. Even if you're not in a stroke group or not feeling like you want to be in a smaller support group, be at some of our activities so that you get used to seeing, hey, there's somebody and how much they've changed, what they're working on.
And then you also have support groups for caregivers, or a support group for caregivers.
We're the only ones. The whole
Peninsula Stroke is-
caregiver.
Right.
So I'm 6 months in the hospital. The social worker never talked
Right.
about me. It was always about her. There's no support at all. This is a whole different segment of, of the support that needs to go on, and that has to happen. And that's what we're
And you
we
are
seek to
doing
address.
some of that.
So we are very unique, I think, in that we're
yeah.
offering one of the first support groups for caregivers.
And now, within the support groups, do you break them down into support groups for young stroke survivors, or is it just
Well, there's a couple
For
of
the
options.
stroke survivors.
Yeah.
For example, there's one that is just for women.
that's-
Also, where we hold our location, and it's also the time of year, time of
Right.
day, you'll get the different mix. We've
Sure.
kind of dialed it in over the years that by these locations, we get a good mixture of folks. What's a good mixture? Those who are showing up and into it enough, into their journey of renewal enough
they can-
that they're able to share and offer something.
sure.
Because at this time and working in these things, you don't want there, it'll get better. That
Now-
doesn't help anyone.
Now, understand that May is Stroke Awareness.
It is,
Month.
Stroke Awareness
For
Month.
the Peninsula Stroke Association
Nationally.
or nationally?
Nationally.
And so what do you do, what does the Peninsula Stroke Association do to observe May?
Well, one of the major things that we do is to hold regional conferences for the public and for healthcare professionals, so that
At the conference, there are certain lectures for professionals, others for...
for the public, or we
Yes.
may mix the two and have people, the scientists that are really doing
Yes.
the research, come and talk about the latest state-of-the-art science in the area of stroke.
And you have a number of these.
We do, often all the way up the peninsula. So as far down as San Jose to as far north as San Mateo or Burlingame.
And who chooses the topics?
Well, as Matt had mentioned earlier, we have a scientific advisory board that has 19 scientists, physicians, nurses on it, and they help us to choose the latest topics.
And
that
they invite
should
the
be
guests or
introduced.
decide who the guests should be,
Right.
that sort of... Are they well
They're
attended?
very well attended. We may have as many as 300 individuals in San Jose, and we may have another event in a assisted living facility in which we get a lot of elderly individuals, and so it's
So you
very, very
vary
nice.
where you have the events, too.
We do. We do.
To accommodate different audiences.
That's correct.
Now, also I understand November is another special month.
November is another special month, and essentially we have one of the only health fairs that we're aware of, the only health fair that is specific to stroke survivors. So I'm going to let Vangie talk a little bit about that.
Right.
Have you gone to that
Oh, every year.
every year?
Yeah, 'cause I think they're great. The thing they do is they show you what other stroke survivors are using.
Yeah, what kind of
cook.
equipment?
Yeah, cook, how they should cook, what modifications they need to do to their house, all that stuff.
And there are vendors who sell the various things you need to make those modifications.
Right.
So cooking is one instance. What are some of the other things?
Well, there's a couple things, and it isn't just vendors, because there's a lot of organizations that will help in place. So you can get connected for home modification, what to do. You'll see some of the exhibitors are stroke survivors. This is just what I've done.
Right.
Here's my email, talk to me. Vangie's big issue is how do you get clothing you can dress for yourself? So
you never
we
think
work
about that, but of course.
Precisely. So what stores are friendly towards that? What will help do all the assistant dressing, so that you have alternatives? So this is their way to physically network, as well as some people try networking. It depends on your recovery, how you're able to network,
And I understand you also have a resource directory.
We have one of the most widely utilized resource directories for all of the hospitals in both Santa Clara and
they're
San Mateo
available
County.
at-
They're
okay.
available free of charge. All of the hospitals in these areas use them.
And do they give them out
And they
as
give
they're
them out
discharging the
as they
patients?
discharge patients. And if you're interested in getting a resource directory, once again, you can either call or email the association.
Now, if someone out there wanted to donate to the association, I assume that there you do have, even though because you don't charge for anything, you have need for funds.
We do.
Same thing.
Our funds come primarily through individuals, but also from corporations and foundations. And anyone that would like to give to the association, we would welcome a gift
Absolutely.
to support our continuing efforts.
Great. So anyone who's interested in any way would just contact you either on your website, on the phone number that we're running.
Right.
There's just so much material here, and I thank you all so much for coming tonight. You've really given us whole new insights. You, Nancy, from the medical standpoint and the research, and Vangie as someone who has been there and continues, as you said, you're a stroke survivor for the rest of your life.
For the rest of my life.
And certainly Matt from the standpoint of the board and as a caregiver. So I think we've gotten a wide perspective on this. And thank you all, and thank everyone for watching AAUW.